Hey Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is NCLEX Question Review Lesson 49, Emergency Care Questions. You can get my study guides on Etsy. You can follow me on Facebook, Instagram, and TikTok for more content. All links are in the description. Without the way, let's get started.
Question 1. The client arrives at the emergency department after a burn injury that occurred in the basement at home, and an inhalation injury is suspected. Which should the nurse anticipate as being prescribed for the client? A. Oxygen via nasal cannula at 10 liters. B. Oxygen via nasal cannula at 15 liters. C. 100% oxygen via an aerosol mask. D. 100% oxygen via a tight-fitting, non-rebreather face mask. The correct answer is D. 100% oxygen via a tight-fitting, non-rebreather face mask. Rationale: if an inhalation injury is suspected, the administration of 100% oxygen via a tight-fitting, non-rebreather face mask is prescribed until the carboxyhemoglobin level falls below 15%. With inhalation injuries, the oropharynx is inspected for evidence of erythema, blisters, or ulcerations. The need for endotracheal intubation is also determined. Question 2. The nurse assists in planning care for a child who sustained a burn injury. The nurse plans care based on which accurate statement? A. Scarring is not as severe in a child as in an adult. B. Children are at a lower risk of infection than adults because of their strong immune systems. C. Lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. D. Infants and children are at decreased risk for protein and calorie deficiency because they have smaller muscle mass and less body fat than adults. The correct answer is C. Lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. Rationale: lower burn temperatures and shorter exposure to heat can cause a more severe burn in a child than an adult because a child's skin is thinner. Scarring is more severe in a child. An immature immune system presents an increased risk of infection for infants and young children. Infants and children are at increased risk for protein and calorie deficiency because they have smaller muscle mass and less body fat than adults. Question 3. The nurse is caring for an infant with a diagnosis of tetralogy of Fallot. The infant suddenly becomes cyanotic, and the oxygen saturation reading drops to 60%. Which interventions should the nurse perform? Select all that apply. A. Call a code blue. B. Notify the healthcare provider. C. Place the infant in a prone position. D. Prepare to administer morphine sulfate. E. Prepare to administer intravenous fluids. F. Prepare to administer 100% oxygen by face mask. The correct answers are B. Notify the healthcare provider. D. Prepare to administer morphine sulfate. E. Prepare to administer intravenous fluids. And F. Prepare to administer 100% oxygen by face mask. Rationale: the child who is cyanotic, with oxygen saturations dropping to 60%, is having a hypercyanotic episode. Hypercyanotic episodes often occur among infants with tetralogy of Fallot. If a hypercyanotic episode occurs, the infant is placed in a knee-chest position immediately. The HCP is notified. The knee-chest position improves systemic arterial oxygen saturation by decreasing venous return so that smaller amounts of highly saturated blood reach the heart. There is no reason to call a code blue unless respirations cease. Additional interventions include administering 100% oxygen by face mask, morphine sulfate, and intravenous fluids as prescribed. Question 4. The nurse is caring for a client who has just been admitted to the nursing unit after receiving flame burns to the face and chest. The nurse notes a hoarse cough, and the client is expectorating sputum with black flecks. The client suddenly becomes restless, and his color is becoming dusky. The nurse should interpret this data as indicating which: A. The client is hypotensive. B. Pain is present from the burn injury. C. The burn has probably caused laryngeal edema, which has occluded the airway. D. The client is afraid and is having a panic attack as a result of the unfamiliar surroundings. The correct answer is C. The burn has probably caused laryngeal edema, which has occluded the airway. Rationale: the client exhibits several warning signs of an inhalation injury, a history of a flame burn to the face, hoarseness, cough, carbonaceous sputum, singed facial hair, facial edema, and color change. Additionally, one of the cardinal signs of hypoxia is restlessness. Question 5. The nurse is assisting with caring for a client who is receiving intravenous fluids and who has sustained full-thickness burn injuries of the back and legs. The nurse understands that which would provide the most reliable indicator for determining the adequacy of the fluid resuscitation. A. Vital signs. B. Urine output. C. Mental status. D. Peripheral pulses. The correct answer is B. Urine output. Rationale: successful or adequate fluid resuscitation in the adult is signaled by stable vital signs, adequate urine output, palpable peripheral pulses, and a clear sensorium. The most reliable indicator for determining the adequacy of fluid resuscitation is the urine output. For an adult, the hourly urine volume should be 30 to 50 milliliter. Question 6. A family of a spinal cord injured client rushes to the nursing station, saying that the client needs immediate help. On entering the room, the nurse notes that the client is diaphoretic, with a flushed face and neck, and complains of a severe headache. The pulse is 40 beats per minute, and the blood pressure is 230/100. The nurse acts quickly, knowing that the client is experiencing which? A. Spinal shock. B. Pulmonary embolism. C. Autonomic dysreflexia. D. Malignant hyperthermia. The correct answer is C. Autonomic dysreflexia. Rationale: the client with spinal cord injury above the level of T7 is at risk for autonomic dysreflexia. It is characterized by severe, throbbing headache, flushing of the face and neck, bradycardia, and sudden, severe hypertension. Other signs include nasal stuffiness, blurred vision, nausea, and sweating. It is a life-threatening syndrome, triggered by a noxious stimulus below the level of the injury. Question 7. The nurse is performing a vaginal check of a pregnant client in labor. The nurse notes that the umbilical cord is protruding from the vagina. Which action should the nurse immediately perform? A. Administer oxygen to the client. B. Transport the client to the delivery room. C. Place an external fetal monitor on the client. D. Exert upward pressure against the presenting part with gloved fingers. The correct answer is D. Exert upward pressure against the presenting part with gloved fingers. Rationale: if the umbilical cord is protruding from the vagina, no attempt should be made to replace it, because to do so could traumatize it and further reduce blood flow. The nurse should place a gloved hand into the vagina toward the cervix and exert upward pressure against the presenting part to relieve compression of the cord. The nurse also should wrap the cord loosely in a sterile towel saturated with warm, sterile normal saline solution. Oxygen, 8 to 10 liter per minute by face mask, is administered to the mother to increase fetal oxygenation, and the client is prepared for immediate delivery. However, the immediate action is to relieve pressure on the cord. The client would already have an external fetal monitor in place. Question 8. A client in the postpartum unit complains of sudden, sharp chest pain. The client is tachycardic, and the respiratory rate is increased, and the healthcare provider diagnoses a pulmonary embolism. Which interventions apply to the care of this client? Select all that apply. A. Administer oxygen. B. Monitor the blood pressure. C. Prepare to administer morphine sulfate. D. Prepare to start an intravenous line. F. Place the client on bed rest in a supine position. E. Prepare to administer warfarin sodium. The correct answers are A. Administer oxygen, B. Monitor the blood pressure, C. Prepare to administer morphine sulfate, and D. Prepare to start an intravenous line. Rationale: if pulmonary embolism is suspected, oxygen is administered to decrease hypoxia. The client also is kept on bed rest, with the head of the bed slightly elevated, not supine, to reduce dyspnea. Morphine sulfate may be prescribed for the client to reduce pain and apprehension. An IV line also will be required, and vital signs must be monitored. Heparin therapy is administered. Question 9. A child is admitted to the burn unit with partial and full thickness burns over 35% of the body. The nurse assisting in caring for the child develops the plan of care. Which nursing intervention is the priority? A. Inserting a Foley catheter. B. Inserting a nasogastric tube. C. Restricting intravenous fluids. D. Sedating the child with morphine sulfate. The correct answer is A. Inserting a Foley catheter. Rationale: a Foley catheter is inserted into the child's bladder so that urine output can be accurately measured hourly. Although pain medication may be required, the child should not be sedated. IV fluids are not restricted and are administered at a rate sufficient to maintain adequate tissue perfusion. A nasogastric tube may be required but would not be the priority intervention. Question 10. A child is hospitalized with a diagnosis of lead poisoning. The nurse caring for the child should prepare to assist in administering which medication? A. Activated charcoal. B. Sodium bicarbonate. C. Syrup of ipecac. D. Dimercaprol. The correct answer is D. Dimercaprol. Rationale: dimercaprol is a chelating agent that is administered to remove lead from the circulating blood and from some tissues and organs for excretion in the urine. Sodium bicarbonate may be used in salicylate poisoning. Syrup of ipecac is used in the hospital setting, in poisonings, to induce vomiting. Activated charcoal is used to decrease absorption in certain poisoning situations. Note that dimercaprol is prepared with peanut oil, and hence should be avoided by clients with known or suspected peanut allergy. Question 11. The emergency department nurse is caring for a child, brought to the emergency department, following the ingestion of approximately 1/2 bottle of acetylsalicylic acid. Which should the nurse anticipate as the likely initial treatment? A. Dialysis. B. The administration of vitamin K. C. The administration of activated charcoal. D. The administration of sodium bicarbonate. The correct answer is C. The administration of activated charcoal. Rationale: initial treatment of salicylate overdose includes administration of activated charcoal to decrease absorption of the aspirin. Intravenous fluids and inducing emesis may be prescribed to enhance excretion, but would not be the initial treatment. Dialysis is used in extreme cases if the child is unresponsive to therapy. Vitamin K is the antidote for warfarin overdose. Question 12. The nurse is assisting in preparing to administer acetylcysteine to a client with an overdose of acetaminophen. How should the nurse administer the medication? A. Administer the medication subcutaneously in the deltoid muscle. B. Administer the medication by the intramuscular route in the gluteal muscle. C. Administer the medication by the intramuscular route, mixed in 10 ml of normal saline. D. Mix the medication in a flavored iced drink and allow the client to drink the medication through a straw. The correct answer is D. Mix the medication in a flavored iced drink and allow the client to drink the medication through a straw. Rationale: because acetylcysteine has a pervasive odor of rotten eggs, it must be disguised in a flavored iced drink. It is consumed preferably through a straw to minimize contact with the mouth. It is not administered by the intramuscular or subcutaneous route. Question 13. A client who sustained an inhalation injury arrives in the emergency department. On data collection, the nurse notes that the client is very confused and combative. The nurse determines that the client is experiencing which? A. Fear. B. Pain. C. Hypoxia. D. Anxiety. The correct answer is C. Hypoxia. Rationale: after a burn injury, clients are normally alert. If a client becomes confused or combative, hypoxia may be the cause. Hypoxia occurs after inhalation injury and may occur after an electrical injury. Question 14. A client is brought to the emergency department following a smoke inhalation injury. The initial nursing action is to prepare the client to receive which treatment? A. Pain medication. B. Endotracheal intubation. C. Oxygen via nasal cannula. D. 100% humidified oxygen by face mask. The correct answer is D. 100% humidified oxygen by face mask. Rationale: if the client sustains a smoke inhalation injury, the client is treated immediately with 100% humidified oxygen delivered by face mask. Oxygen via nasal cannula will not provide adequate oxygenation. Endotracheal intubation is needed if the client exhibits respiratory stridor, which then indicates airway obstruction. Pain management is necessary but is not the initial concern. Question 15. An emergency department nurse is caring for a client who sustained a burn injury to the anterior arms and anterior chest area. The client sustained the burn from a home fire that occurred in the basement. Which data would indicate that the client sustained a respiratory injury as a result of the burn? A. Fear and anxiety. B. Complaints of pain. C. Clear breath sounds. D. Use of accessory muscles for breathing. The correct answer is D. Use of accessory muscles for breathing. Rationale: clinical indicators in a burn client that would indicate respiratory injury include the presence of facial burns, the presence of soot around the mouth or nose, and singed nasal hairs. Signs of respiratory difficulty include changes in respiratory rate and the use of accessory muscles for breathing. Although anxiety may be a sign of hypoxemia, anxiety along with bradycardia, dysrhythmias, and lethargy would most likely indicate a concern related to a respiratory injury. Abnormal breath sounds and abnormal arterial blood gas values would also be noted. Pain is not specifically related to a respiratory injury. Question 16. A postpartum client has lost 700 milliliter of blood. The vital signs indicate hypovolemia, and the uterus remains atonic in spite of treatment. The nurse assisting in caring for the client understands what is necessary in this situation and prepares the client for which treatment? A. Fundal massage. B. A blood transfusion. C. Emergency surgery. D. An infusion of oxytocin. The correct answer is C. Emergency surgery. Rationale: options A, B, and D identify interventions to reverse uterine atony. When uterine atony cannot be reversed, surgery is required. Question 17. The nurse assists in administering first aid to a client who has been bitten by a snake on the right leg. The nurse should take which action? A. Apply a tourniquet. B. Apply ice to the site of the bite. C. Elevate the leg above the level of the heart. D. Ensure that the victim is lying down and remove restrictive items. The correct answer is D. Ensure that the victim is lying down and remove restrictive items. Rationale: initial first aid at the site of a snakebite includes having the victim lie down, removing constrictive items such as clothing or rings, providing warmth, cleansing the wound, covering the wound with a light sterile dressing, and immobilizing the injured body part below the level of the heart. ice or a tourniquet is not applied during the acute stage. Question 18. The nurse receives a telephone call from a neighbor, who states that her child was found sitting on the floor, near the kitchen sink, playing with several bottles of cleaning fluids. The bottles of cleaning fluid were opened and spilled on the child and the floor, and the mother suspects that the child may have consumed some of the cleaning fluid. Which action should the nurse tell the mother to do immediately? A. Call the healthcare provider. B. Call the poison control center. C. Call the pharmacy to purchase syrup of ipecac for administration. D. Call an ambulance to bring the child to the emergency department. The correct answer is B. Call the poison control center. Rationale: the poison control center should be called if an unknown toxic agent has been ingested, or if it is necessary to identify an antidote for a known toxic agent. Syrup of ipecac is used to induce vomiting in a conscious client, but vomiting is not induced after ingestion of caustic substances or petroleum distillates. In addition, it is inadvisable for parents to administer syrup of ipecac. This action, if warranted, should be done under medical supervision. Calling an ambulance or calling the health care provider will delay necessary life-saving measures. Question 19. The nurse discusses emergency nursing measures that are implemented at the site of an injury with a nursing student. Which initial action does the nurse tell the student to perform in the event of carbon monoxide poisoning? A. Carry the client to fresh air. B. Wrap the client in blankets. C. Keep the client as quiet as possible. D. Initiate cardiopulmonary resuscitation. The correct answer is A. Carry the client to fresh air. Rationale: whenever a victim inhales a poison, the victim is carried immediately to fresh air. Any tight clothing is then loosened and CPR is initiated if necessary. Oxygen is administered as soon as possible. Chilling is prevented and the victim is wrapped in blankets and kept as quiet as possible. Question 20. A client who sustained a severe burn injury is brought to the emergency department. The nurse prepares to implement which immediate action? A. Insert an endotracheal tube. B. Assess neurological function. C. Administer 100% humidified oxygen. D. Cover the client with a warm blanket. The correct answer is C. Administer 100% humidified oxygen. Rationale: when a victim who sustains a burn injury arrives at the emergency department, a patent airway is established and breathing is assessed immediately. The client is also immediately given 100% humidified oxygen. If the victim has severe respiratory distress or airway edema, then an endotracheal tube is inserted for mechanical ventilation. Clean sheets are placed over the client and the client's body temperature is maintained. The client's neurological status is assessed, however, this is not the immediate action.